Welcome to this presentation on Rare Diseases National Extension. Our presenter is Dr. Lopez. My name is Ian Green. I'm the Customer Relations Lead for Europe and the Clinical Engagement Manager for SNOMED International. We'll have a live question and answer session at the end, but if you have questions during the presentation, please put them in the Q&A button on the screen. And I'll hand over to you, Dr. Lopez.
Hello, good morning to everybody. I'm walking to talk about the array of diseases in a national extension. Okay. Introduction. According to the European Union definition, rare, minority, orphan diseases are disorders at risk of causing death or chronic disability that have a prevalence of less than 5 cases per 10,000 inhabitants. The objective started when in 2014 the Clinical Information Systems team of the General By-Direction of Health Information and Innovation of the Ministry of Health of Spain decided to initiate the creation and development of a reference set of rare disorders. First one, in order to improve the visibility of rare diseases in terminologies and to promote interoperability between different coding systems and terminology systems. The mission was to facilitate the use of SNOMED CT as interface terminology for the capture, coding, and retrieval of cases in the healthcare records and in the population-based or monographic registries. The following challenges and shortcomings were observed. Coverage in alphabetical indexes of health problem classification is poor. The main source of reference information is ORFA, but it does not include a mapping to SNOMED CT. The need to accurately classify diseases in the record are poorly covered. The existence of polyhierarchy is often an essential attribute in systematizing rare diseases. On the other hand, no graphical representations, dendrograms, are available on the distributions of disorders. The methodology which we used for the development of the recipe was initiated from content already existing in the terminology. Initially, the inclusions of concepts for the international edition were absolute majority. Processing of users' requests was initiated after checks of existing concepts to avoid duplicate. Later, the systematic study of ORFA equivalences for each proposed concept was initiated as a means of verifying that member candidate concepts actually corresponded to a rare disease. The hierarchical structure of terminology was enhanced as much as possible in order to systematize concepts, their superclasses or subclasses. As of 2015, with the publication of the Royal Decree on the creation of the National Registry of Rare Diseases, the demand for concepts experiences significant growth. The working group that was formed to facilitate the actions derived from the Royal Decree formally adopted SNOMED CT as one of the standard terminologies for registry data sharing. The new concepts are being created and maintained using authoring and editorial processes in accordance with the procedures established by SNOMED International. There is an important activity of synonym creation to facilitate searches with frequently used terms. Once the reference set reached a considerable volume of members, systematic mapping work began with ORPA codes and subsequently with CIE-10ES, equivalent to the US ICD-10-CM, that is a national standard for hospital morbidity adopted in Spain. Later, from the content of the receipt, HTML navigation viewers were developed with interactive search. For one hand, to facilitate the retrieval of concepts and terms based on bilingual support in Spanish and English. Viewers provide numerous links for better coexistence with other terminologies resources. Links were also created to reference and consultation pages on SNOMED CT content, or to email message for new proposals or improvements. The results. There are currently 3,186 components of active concepts. In the near future, it is intending to increase number of members in the RefSet as a result of the ongoing collaboration between CERM and SNOMED International to map and harmonize terminologies on rare diseases, which will require the introduction and update of numerous concept definitions. Among the operations carried out on the concepts included in the RefSet, 3,412 have taken place in the international core, and 816 in the national extension for Spain. All the concepts for the national extension for Spain, most additions are responding to requests from individuals or licensing organizations. The temporal origin of the concept has been studied to understand the pattern of evolution of RefSet members over time. Sorry, because the image is a little small. The reference set can be used to accurately identify rare diseases in electronic health records, in clinical information systems, departmental databases, clinical administrative records, or knowledge spaces for decision-making support and clinical safety. The viewer, as I taught before, is created to facilitate the use of RefSets in information capture work. For the SNOMED CT National Reference Center for Spain regularly develops and publishes a viewer with a dynamic term search capability. This consultation system also includes some cross-reference resources that have been considered particularly relevant. Mapping includes ORFA codes and CIE10ES classes. That this is the classification system adopted in Spain as a national standard for hospital morbidity. All the resources is present in the viewer. Well, as conclusions, we think about with the use of the rare diseases RefSets in electronic health records and registry systems, terminology observation can be an effective tool for detecting new standardization needs. As the 2016 operations on components included in the national extension have outnumbered in certain periods those created in the international edition. Sometimes it's outnumbered concepts from the national extension over the international edition. Release of mapping resources between SNOMED CT and ORFA codes will have a profound impact on concept coverage and RefSet members volume. SNOMED CT will become one of the most important reference terminology resources in the rare disease domain. The distribution of this standardized product is a service provided by the National Reference Center of SNOMED CT for Spain. Thank you so much.
Hello, my name's Ian Green. I work for SNOMED International. I'm moderating this Q&A session. Unfortunately, Dr. Lopez has had some scheduling difficulties, so will be unable to attend presently. However, any questions that you wish to submit will forward on to Dr. Lopez. The one that I can answer is the question from Inga. They haven't currently had a look at the alpha release of the author to SNOMED mapping, but we'll be working with them to get them to use the alpha release that's currently out there. I do apologize for Dr. Lopez's unavailability, but in her absence, I'll bring this session to a close. But thank you for your attention.